As a regular viewer of MSF TV, you may have seen our exclusive stories from Leia Hospital in South Sudan. Well, here with me now is senior producer Rachel Hardy, who has just come back also from filming in Papua New Guinea. Rachel, welcome.
Thank you.
Yes, you went to South Sudan before PNG. Let's have a quick look at some of your work there.
I was born in the war, I grew up in the war. I had a real experience in war. We had like 3 times our hut, this local hut were destroyed, and my father was killed in 1994. And then when the war comes, then you have to run for your safeties. I would say I got lucky because I'm still alive today. I was born at home 10 days ago. The main problem is the abscess on the breast. It's actually incredible to be with MSF. I'm working here as a clinical officer and I'm doing my internship. Basically, what it means is when you finish your training, you will be able to go to the community and help them, educate them how they can do the prevention. It's more about primary health care. Working in healthcare is a teamwork, it's not just an individual work. You may know something, but you may not put it in a correct way unless maybe you share it with somebody.
So Peter's an extraordinary individual. You met some really fabulous local staff on the ground in South Sudan, didn't you?
Yeah, I did. It was quite an incredible experience, and I think one of the most eye-opening things for me was you know, MSF, for me, not being a member of MSF, being an independent filmmaker, you know, I was expecting to meet a lot of expats. I had no idea the sheer amount of national staff that I would meet. In Leia Hospital, there was 220 national staff, all of whom are very passionate and really impressive in terms of how much they want to give back to their country and help their own people. And they're probably the most stable because a lot of MSF expats will come and go over the years, but a lot of people there have been there for many years. Someone like Peter is just very inspirational. He's one of the many. You know, he's someone who has been largely affected personally by civil war. He lost his father, and you know, he ended up fleeing, but has come back to really try and make a difference.
And learn as well on the ground from Médecins, Sans Frontières.
Absolutely, yeah.
And what was it like actually filming there?
Hot. Really quite extraordinary, to be honest. Really humbling. You know, I was given a bit of a brief, obviously, going out to, you know, what I might expect, but I think I was really blown away by the work that's done there by expats and national staff, and also just how grateful the patients are as well, because the fact of the matter is, if that service and that hospital wasn't there, these people would all die. So it's really quite confronting in that way, but really humbling that there's a lot of people there who are prepared to essentially sacrifice their own lives to help others.
So how's that affected you?
I mean, I'm still trying to come up with a better word other than humbling, but it's really been quite quite a humbling experience. I'm afraid that I don't have a better word than that at the moment.
I suppose it's ongoing as well. You think back to it over this time. The further you get away, it seems differently. Now, you shot 4 pieces, some really moving pieces. Tell us about them in terms of how they impacted your overall feeling of the place.
Well, we filmed with people who are not a doctor or a nurse, so non-medical staff. And you know, again, that was something that was quite a learning experience for myself as well, because I think a lot of people out there don't actually realize that you don't have to be a doctor or a nurse. Of course, they're necessary, but there's a lot of logistics and a lot of roles for people as logisticians. as well as project coordinators. And I think that you know, they have just as much of a challenge as doctors and nurses, and are just as much inspiring to be able to, well, essentially the backbone of the project. So we focused on non-medical staff, so it was really great to get to know the people there and see the work they do, and sort of, you know, see the engine room, really. And national staff, which you've just seen, and Kala Azar, which was a real eye-opener. You know, it's a disease that I think there's been quite a lot, actually there has been quite a lot on MSF TV about that disease, which is largely unknown in the West. So yeah, those are...
yeah, so the Kala Azar is the disease that's spread by the sandfly, the female sandfly, and there's another film you've made where you see a woman actually collapsing after she's been affected by the disease, and it's one that many people don't know about, but you saw it in really stark images on the ground there.
Yeah, it's visually disturbing to see how quickly people deteriorate with this disease. It's a disease, as I said, that nobody in the West knows about, and in actual fact, if you have it, you're best off in an MSF hospital in one of the places where it's most common. It's not transmittable person to person. I'm not a medical person, but it is, you know, you get it by sandfly, and it basically causes anemia. It causes almost like Parkinson-like shakes where you cannot control your body at all. There's a real lack of blood donations, actually, which is the biggest need there at the moment to keep people going.
That was a very dramatic part of your film. What was it like filming there? What were the complications and the difficulties on the ground?
The logistics, really. We're in the middle of nowhere. There are no roads, there's no infrastructure, you know, there's no corner shop down the road, there's no chemist, you know, apart from what's in the hospital. So, you know, supplies are a really big, important part of this program, as we saw in Kala Azar, because there's, you know, with unpredictable weather changes comes unpredictable rise and fall of disease. So it appeared while I was there that Kala Azar was actually on the increase for that period because of the extended rain season. And so what basically happened was that they started to run out of the medicine, but because of the logistics, because you know, you really are in no man's land in a lot of places, the road less traveled, it's very hard to get medicine in and out because there's nowhere to land, and if it rains, well, how and where is the plane going to land?
Shows a lot of those complications and difficulties. Now, you also went to Papua New Guinea, and we're still editing those films for MSF TV, but let's have a very small sneak preview of what you did there.
My husband used a bush knife and chopped me on my arm. Two men are brought to my OT and they both are chopped. The other one chopped on the head, and the other one is chopped on the left foot.
The most frequent injury is being caused by the bush knife.
Concerning violence, even though I am from Tari, I am always scared.
Axe wounds as well can be very bad, so that's actually the most frequent thing, and stabbing wounds with knives.
Bush knife are used to chop bushes, and it's a bit long, about 70 centimeters long, with a small handle like this, a wooden handle.
Some really strong and, you know, powerful images there of those knives. What are your stories about?
Essentially, Papua New Guinea is this very lush, very beautiful, aesthetically beautiful country. And people are very welcoming and warm. However, there is this sort of quite dark and disturbing underlying current of violence. A lot of people, and I myself included, going out there thought that it was part of their culture, and it isn't. It's something that's evolved over time. So it's literally about looking at the issues there. There's a, you know, MSF has gone there and actually identified gaps in a system, gaps in the healthcare, and basically there's an increasing amount of violence and sexual violence, interpersonal violence, and sexual abuse of adults and children. And they have these family support centres there, which are quite unique. And I think inadvertently almost, you know, not only treating the issues there, but also almost providing preventative care in a way with trying to heal people and address the issue of what's going on.
So from your experience, what was that like to see those very unique programs and work that they're doing? It was,
you know, truth be told, it was disturbing. You know, such brutal violence is very hard to understand, very hard to, you know, you can find as many justifications as you like about history and culture, but at the end of the day, it's very unlike our, you know, Australia and social behaviours. But you also have to respect their cultures and their way of life and understand their history as well. But really disturbing, quite very sometimes what seems vicious and sadistic, but I think that they are crying out to be helped. They are asking for help to find better ways.
Well, we'll be able to see your films very soon on MSF TV. Thank you. Rachel Hardy, who's just returned from Papua New Guinea and South Sudan for MSF TV. She's a senior producer, and those films will be up very soon.